You have to be a unicorn. What's different about me versus other people?
Thank you for being here. Welcome to Lichiner's YouTube channel.
Thanks for the invite. Excited to be here today.
Awesome. You have a very unique nursing experience prior to that, and you were a combat medic in the U.S. Army before nursing. So why did you choose nursing among all the healthcare professions?
It was pretty easy decisions. Being a medic in the Army, you work with a lot of healthcare workers, like PAs, NPs, nurses, surgeons, and the whole team of healthcare workers. And with that, you look for things that would attract you. Being a medic, you like the fast pace, you like to take control over the whole camaraderie that you build with your colleagues and your buddies. The nursing profession was the one that it kind of stand out the most. They get a lot of respect. They take a lot of control over situations, and they have a lot of autonomy, which really was the key for me to choose nursing. I can only talk about being a military. So I thought that nursing was the first step that I want to get into, and then I'll think about the rest later. That's how I chose nursing at the time.
Okay. How was your experience as a combat medic in the U.S. Army? Were you deployed?
So I grew up in New Jersey. When I was 10th grade in high school, I learned about New Jersey National Guard. I guess it was New Jersey Army Reserve. The New Jersey Army, well funded by the state. They would give that money to the soldiers who are in New Jersey National Guard, and they would waive your state college tuitions. I grew up in an immigrant family where my mom and my dad, they work hard and realized that we're not rich. You start thinking about, hey, what are the ways I can do to go to college? That was attractive for me to join National Guard in the beginning. With the New Jersey National Guard, you get the GI Bill, which is offered to all the soldiers. You can use that money towards your education. Because I previously had shadowing and some observation experience with the physical therapists and nurses, medic would be the one profession that I would like to get into because love the anatomy and physiology, things like that. It's like, hey, I want to be a medic. And it's such a manly thing to do. Working as a medic in the Army, I think that's what made me who I am today. Talking about military, it's mandatory in Korea, but I chose to join military because there's something about being a military makes you a better person, I thought. I grew up as a youngest child. I have three older sisters. They like to baby me, I thought that was a good way to kind of change up the scene, discipline, dedication, the motivation that you learn. You have to be patriotic to join the military. But working as a medic, I would recommend it to anyone who's interested in healthcare. It's such a good way to take a first step into healthcare role. Yes, I was deployed overseas. Every year we would go to medical mission. We can go to Honduras, Nicaragua, and then we set up a clinic. We'll help the civilians who desperately need help. You go into a place where people are very vulnerable and you learn about what they go through. What we actually have in America is a huge difference there. It makes you humble. In all different aspects, it makes you a better person. I feel like I was spoiled growing up. Overall, it was a very good experience for me.
Thank you for sharing that. What you mentioned about dedication and discipline, and also you were exposed to different healthcare professions there, like PAs and Ps and nurses. And you said that it made sense for you to have that autonomy as a nurse. Right now, you are senior nurse practitioner at Columbia University. A lot of things, I bet, has happened since you're in the U.S. Army to nursing school to an advanced practice degree.
Sure.
What specific actions did you take in each transition?
When you're in the medic in the Army, we earned a certification of EMT. Within the EMT, there's three different levels in the Army. There's a basic, there's intermediate, and there's a paramedic. Here in civilian side, you don't see immediate, but you only see basic or paramedics. Paramedics are able to start IV and inject medications. You can intubate, you can shock them. We had the same autonomy in the Army. Coming out from the military with that experience, clinically it was not challenging at all. Meaning, been there, done that. So I felt pretty comfortable. To go to nursing school, you have to take pre-rac. So you start taking anatomy 1 and 2, pharmacology, you name all the science courses, the math as well. I did that. And I was working as an EMT and I worked in the ER as a technician. With that experience and all the hours you put in as an EMT or ER tech, it was a good foundation for me when I applied for the nursing school. When the nursing school look at it, it's like, hey, no, obviously this guy is interested. It's not like a changing career. Right. Other than just a pre-rac work done myself, you want to taste other professions at the same time. Do I really want to go into nursing? Yes, I do. But then what are other options out there? EMT, being a medic, and it looks cool, but then is it going to really pay at the end? What's the salary look like? Am I going to be single? Eventually, I need to marry and buy a house, have the passion at the same time, but you want to be realistic. You want to set up a realistic goal to get into nursing. But overall, the transition itself was pretty natural, and working on yourself to nursing, working as an EMT, working in the ER helped a lot.
Why was the decision based on going for the advanced degree?
I start my nursing career in the ER, traumas. It's very fast paced. You build up camaraderie with your friends. We go out for a drink after work. It's just such a good environment as a young single person at the time. But then you realize, hey, I see the residents, I see the nurse practitioners and PAs working with us. And it makes you challenge in a way. It's like, I have all this experience already, and I feel like I hit the plateau. I feel too comfortable being who I am, what I do in the ER. And you start thinking, it's like, there's got to be something else out there. What happens to the patients who come in for MI? They get shipped to the cath lab, and what happens to them? Start wondering. So that curiosity made me to observe and shadow other people in the other units, nurse practitioners and PAs. I shadow around and making sure that imagine myself doing this or not. Do you like to be proactive in hierarchy aspect? Nurses, we get orders and then we implement. I wanted to kind of go over that. Like, I wanted to be able to make decisions. To me, that was more challenging part. I wanted to do more, and I wanted to do better for myself, and I did not want to stay as a bedside nursing forever. And of course, at the time, I was not really thinking too much about how much am I going to make as an MP, but definitely more than nurse, just like everyone else. Like, you work full time. I had actually 3 jobs at the time.
Oh my God.
Working full time, working part time, and per diem. So I did all 3 plus the nursing school, and I did it with my friends from ER. So it's like 5 of us. We did the same exact thing.
Oh wow.
So which was helpful. If you're doing solo, then I probably gave up already, because you're doing with your buddies and friends. It made it a lot easier, because when you listen to lectures and sometimes you miss things. Having study groups, I think that was huge success overall.
Right. So it makes sense that since you had almost 10 years of experience in emergency trauma in ICU, so you wanted that leap and challenge yourself.
Yeah, I mean, for sure. After 5 years, you start thinking, I'm getting a little too comfortable from the ER. So you went to ICU, cardiac surgery ICU, where you see all these open heart surgeries, and it's like, wow, pretty cool, but what's next? But obviously, you have to be competent. You cannot just think that, oh, I worked in the ER, I worked in ICU, does not make you a competent nurse, right? I use this phrase a lot. You have to be a unicorn. You have to be special. You have to be able to market yourself. What's different about me versus other people? There are so many smart people out there, that a lot of people with experience. Why would somebody choose me over other people? If I become a nurse practitioner, just like anyone else, I do the same type of work. But what's going to make me special, that if I want to move forward, how is it going to help me to move forward? In umbrella term, I say you need to be a unicorn. That kind of makes you want to be hey, you know what? I'm going to challenge myself. I want to do more. I want to do better. So that kind of pushes you forward.
That's a great question to ask yourself too. What makes me stand out and what makes me different and unique?
Right. I can speak Korean, I can speak English, but then like what else is out there? It's a question for long-term goal, but that's what I want my students to realize, is that, hey, you're going to be just like any other RN when you're done with the school. But moving forward, is it going to be it? There's nothing wrong with being bedside nursing or stay where you are as an RN. I'm not saying that NP is the right way to go. If you are a type of person who loves challenging yourself or experience different areas of nursing, there's other ways. My whole thing was be a unicorn.
Be a unicorn. Yeah. That's a phrase. So you have a myriad of experience in surgeries, trauma, cardiac, and orthopedic surgeries. So for those of us who don't know what your role entails as an acute care nurse practitioner in surgical world, do you actually help perform surgeries, or do you mostly manage pre and post-op patients?
When I start working in the ICU and surgical area, so you start thinking, hey, I want to be that person, but what does it take to be that person? If I like something, I like to find out. I've seen nurse practitioners working in the OR as a first assist or a second assist. And I would go up to the person, hey, I like what you're doing. How did you get there? In order to be in the OR and do the first or second assist to the surgeon, you need to have a certification for that. And it's called RNFA, Registered Nurse First Assistant. And as a nurse practitioner to getting that certification versus a nurse RN to get the certification, there's just 2 different routes. As a nurse practitioner, it's a lot easier. You only have to put like 550 hours clinical time, which is not much. But as a nurse, you need to have an OR certification, and you need to put more than 1,000 hours of a clinical time to get the certification or be able to sit for the boards. At the time, I was a nurse practitioner already. So that way you need to have RNFA, and then you perform surgeries. So when I worked in the trauma and ortho, I did it all. Trauma is more trauma acute care. So that's combined. Somebody who has a belly pain came in and did a CT scan, turned out that has a gallstones, and it's been chronically, it's bothering. So you need to plan for cholecystectomy. That's something that planned surgery. So I would see the patients as an outpatient, and I would talk with my attendings, and then we set up a date for cholecystectomy. The day of surgery, we have a block time during the week. So let's say Friday is our surgery day. In the morning, I would meet with the patients in pre-op area, bring them to the OR. We do the surgery together. We come out, and the patient will stay in the hospital maybe just the same day or next day, and then I follow up with them when the patient's as an inpatient, and then when the patient goes home as a follow-up as an outpatient, we see them all. And same process with the orthopedic surgery. There are not that many people who do that. I like the aspect of pre, intra, and post-op perspective. That way, I feel like I'm in control of taking care of the patient. So if you only do one side or the other, you don't know what's happening, between. So I feel like it was the huge disconnection there. So I'm a type of person that I need to learn from A through Z, then I need to really see exactly how the process goes and step by step.
You're the first person that I met who is an MP that does pre, intra, and post-op.
It was logical to me to understand exactly what happens. Just like working in the ER, somebody has a MI, it turned out that it's a triple vessel disease and these are CABGs, cardiac surgery, and we don't know what's happening because of that particular reason. I actually volunteer for NYP, the New York Presbyterian Organ Procurement Committee. I would fly out with the organ procurement team. And then when we go to another hospital, this is obviously brain dead patients, we're procuring organs. I actually got to open up the chest, anatomy, and actually touch the heart. That's a beating heart. Looking at the liver, kidneys, and pancreas, all this, I had to visualize it. That was a huge learning experience for me to understand what actually looks like inside of the body. Creepy in a way if you think that like working as a medic in the army, you've seen it all. Like you've seen a lot of amputees, a lot of blast injuries. It was just a natural way for me to understand how everything works. That's why I was not afraid of being in the OR and being bloody and getting your hands wet and things like that.
Right. So you have a comprehensive view, Steve.
Overall, that's exactly what it is. Comprehensive view.
So it makes sense to me now that how you were drawn to your emergency, trauma, ICU, and surgical understanding and passion.
I never really had to choose one or the other. For me, it was just a natural pathway. That's what I know. That's what I'm good at. I have a more interest in that field. So why not?
It's really cool that you actually touch the heart.
Right. So, you can do it too.
Yeah, we can do it too.
Anyone who wants to learn, I think that they're pretty open to that idea.
Right. I love your directness and aggressiveness in a good way. When you are curious about something, you go and ask.
Talking about that, I grew up as an introvert. Right? It was such a wake-up call when I joined the military. You cannot be introvert. You have to be aggressive in a way. So it's like flipping the switch. You have to be aggressive when you need to be, but at the same time, you can be compassionate and empathy and sympathy. You can use all that caring part as a nurse. I think that's the cool thing. For me, a military experience was what made me to become who I am, in a sense that I'm able to come home and not so stressed about work. My wife and I, we both in the healthcare field, we talk about, hey, how was your day? And it's not that formal, but we just start venting about, guess what happened? Talking about that it's such a nice way to distress yourself. You have to be direct when you need to be. In the Army, a lot of times you are given a task to do. You carry out the orders. But as an ER nurse, I'm sure you can understand that part. You have to get the questions. You have to get the answers out from the patients. You have to ask the right questions, right? So you have to be very proactive. You have to initiate conversation. You cannot be shy about it. Actually became more extrovert than introvert.
Is your wife also a nurse?
She's actually a transplant surgeon.
Oh, wow.
She does kidneys and pancreas transplant. I met her when I was working in the ER. She was a surgical resident. It was turned out that way. But how lucky she is, right?
So you guys must talk about surgeries all the time.
We do. We share a lot of things, obviously. We're not sharing any patient information, but that's a nice way to discuss. And
Right. You understand where you're coming from.
Yeah.
I think you briefly touched on it when you're explaining the switch from the medic to nursing to advanced practice nursing. There are a lot of listeners and viewers of our conversation who's debating what their next step is in their career. So why would you advise those nurses who's hesitant to go back to school for an advanced degree?
Knowing what I know now, what I would tell tell my students is that there's so many different areas of nursing, and it doesn't have to be nursing. You need to be exposed to different areas of nursing. If you could, emergency is one of them, which is exciting. ICU is exciting. Being a nurse anesthetist, CRNA in the OR, that's up and trending, obviously. It's been going on for a long time. Legal consultant or having your own practice as a holistic nurse practitioner. There's so many different ways you can get into it. I think exposing yourself to learn different fields. You have to kind of go to conferences or seminars. There's different tables out there at the conference, try to implement their profession, explain what they do. And so I think you need to be very open to different ideas. If you feel like nursing might be your thing, but you have to know what's driving you to choose a nursing. Looking at the financial aspect, you can earn as much as you want as a nurse. But if your passion is money, that cannot be only driven factor. Truly want to do something in a positive way other than the finance aspect of it. Otherwise, you're going to burn yourself out. You lose what your passion is. You lose that control over yourself. If you're thinking about nursing, what's actually making you think about nursing? Is it the money? Is it the care that you give and be part of the team member? And what can I do for the patients? What is it making you to be a healthcare provider? I think that's something that you should definitely consider and think about it for a long time before you choose to do something. But at the same time, you want to be realistic. If nursing is not the way to go, then you need to have a plan A, B, and C. My motto is if nursing fails, what's next? Even though your all thoughts and ideas going into nursing, you might want to learn other routes as well. Physician assistant is one of the professions you might consider. There's other healthcare professions out there that you can consider.
Right. There is so much you can do with a nursing degree, and that's what's appreciated about this profession, I think.
Don't get too comfortable where you are and what you do. Once you get comfortable, you're going to lose that passion. I always think about what's next. Can I do this for the next 5 years? And do I have other interests? What can I do? But life happens. It's hard. But then the moment you stop thinking about yourself, I think that's when you lose your control over yourself. I'm not saying that you should be always constantly thinking about what's next, but just looking at the big picture and what do I see in myself in the next 5, 10.
I got curious. What do you think you will be doing in 5 years?
Teaching is my passion. At the same time, I don't want to stay away from the patients. So that's one of the reasons why I did clinical instructor. And I still do. I still go to Hopkins. So they have a DNP program. Students come back between the semesters and they come to the clinical practicum part. So I teach them how to do sutures. I teach them like what I'm doing with you, talking about my profession. And this is the profession I chose. And this is what I've been doing for the last many years. It's a kind of nice way for them to understand, oh, look at this guy, Francis, he's doing this way. And maybe next day, Katie will come in and talk about psych nursing. There's like so many opportunities out there. Don't get bored where you are. Try to explore what's out there. Just be up to date with current events, not just nursing and healthcare in general.
Awesome. So I was in emergency and I got burnt out very quick.
Did you really?
Yeah. How did you deal with that?
Like, what were you feeling? Burnout is such a subjective way. Is it the working hours? Physically burnt out versus psychologically or mentally, emotionally. I think there are different ways you can digest that process. For me, I worked in the busiest shift, 11 a.m. to 11 p.m. And you come in all pumped up and let's do this. The time will go fast. But it's the camaraderie that we build over friends. When you work in one section of the ER, you have a buddies, you have a cover each other. We used to try to make it fun. For example, I had another male nurse. He became my best friend, best man and all that stuff. We would time ourselves. How quickly can we start 14 gauge IV when the next trauma comes in?
14 gauge? Oh my God.
So typically when ER, we do 20 or 18, right? But when you talk about 16 and 14, that's pretty heavy duty.
I don't think I've ever seen 14 gauge.
It's huge. They usually have a cutoff is like about 16, but 14, you don't see that often. It's like putting a central line in, right? So that's how we make it a little more fun and challenging in a way. So that's just one way to do it. And we always talk about, we know we're going to get burnt out. We know this is not the easy profession. Let's get through this shift together. When the shift is done, we all go out together, have a drink and distress. And that's not just the nurses, but PAs, MPs, and doctors, and receptionists, transporters, technicians, every single one that we interact with. There's a huge announcement, hey, we're meeting up at a place after work. A lot of people show up. But some people like to just go home and kind of distress, and it's a different way to tell like the burnout. That itself was a fun thing for me. We try to not to take it too personally. I think that's important. And you see different situations. You see many, many patients throughout your shifts, but then you have to be able to switch on and off. So you can't really get that to you. Otherwise, I think emotionally, it could be struggling thing to do.
Separating that work with life when you come out of the hospital.
So separating it's hard, but then you bring home, you keep thinking about it. One particular patient or one particular situation. It's like, I wonder what happened to her or him. I could have done something differently, maybe. It's a nice way to kind of recap your day, but don't let that drag you for next day and then keep going over and over again. Because that's going to be one patient, and next day it's going to be two patients. It's going to add up. Don't get too emotionally attached to your work. Think of this as a job. It's your career, but you have to kind of draw a line. If you're able to do that, I'm hoping that burnout would be less. Some people may need a therapy. They need someone to talk to. Yeah, I never had like an official therapist, but then my friends were a therapist to me. When you do things as a team, it makes it a lot easier.
Right. That team is so important, who you work with and how you work with them.
Right. You don't have to be so friendly, but then we're all going through the same thing. So I think sharing our experience together among ourselves, that is a nice way to get over the little hump.
I think that'll be especially helpful for new nurses.
Oh yeah, of course. I was lost many times as a new nurse.
Yeah, me too.
Because when I was an ER tech, there was nurses who actually talked to me. What are you going to do in your life? You want to be a nurse? You need to have a good mentor, not just a preceptor. So a lot of times your preceptor could be your colleague, your friend, and a mentor, but just talking about your experience and your burnout feeling, you need to let it out. I think try to digest everything by yourself. I think that's when you get overwhelmed. So I think having a senior person in your department where you can find a person to talk to, I think a good way to overcome the situations like this.
For sure. I wish I knew this when I was in the ER.
Me too. But what do we know? Young people just go for a drink and letting it out in that sense. We will get together. We go for hiking.
You guys are really friends.
Yeah, I mean, all the friends that we made, we still remain friends because we feel like we went through war together. I have a special feeling about ER.
I want to switch gear a little bit. One of the things that we talk about in the channel is about money. Me and all the nurses, I bet including yourself, we learn a lot of things about money and investment over time as we earn money. We make mistakes. What would you want to share to other nurses and other students about investment and money?
It's hard. When you work for a company or hospital, there is a portion of your money you can save, like 403B or 401k. That's for the retirement plan, right? I always maxed out on that. Right now, I think we're allowed to do per year. I think you can put away 18,000 plus. So that's money that you're not going to see anytime soon. You have to put the money on the side. Think about whatever the money you have left over. Having a financial advisor will be greatly recommended. That financial advisor will be able to keep you in line. If you think that you're smart enough to invest money privately, if you're good with that, I have no control of it. But for me, I was never good with that. I wouldn't know anything about the stock market or an economy. I would hire a financial advisor to discuss, or accountant, or who has an understand of money, how the money flows. Because as a nurse, if you work hourly, you eat what you killed, right? So meaning you put in the hours, you get the money. As a new nurse or young nurses, some people could work 2-3 jobs, and all of a sudden you're making all of this money. You may not know what to do with that type of money. Having a financial advisor to kind of guide you in a way, having that idea of, hey, this is how much you can put away per month, and in 10 years, this is how much you're going to be looking at. And that kind of motivates you to be mindful about how you spend money.
Right. How did you find your financial advisor?
So when you go to conferences, there's always people out there. You see a lot of legal consultants, see a lot of financial advisor, accountants. When you sign up for retirement plan, like 403B or 401k, they're the one who can guide you in a way. Vanguard, TIAA, whoever you have a retirement plan with, they usually have a separate department for financial advisor, and they can actually have a lot of connections. You can talk with them, and a lot of times it's free. If you work for a hospital, part of the benefit is that you could get free legal consultants, things like that. If you start looking into your benefit, usually you can find those financial advisors pretty affordable.
That's good to know. I started working, I had no idea how to manage money.
So I think knowing what I know, maybe I will be driving some very expensive car right now. You all learn from mistake. Somebody can tell you ahead of time, that's a good thing, and if you listen to it. But if you have to learn the harder way, it's okay too. Never too late.
Right, never too late.
I'm sure you can talk about your situation too.
I like real estate, so I talk about that a lot.
Oh, you do?
Yeah.
I have a zero experience or knowledge in that.
It's a big decision. I think that's why it's scary.
You have to think about the equity you're going to build up for going to real estate, right?
Yeah. We can talk about it later if we get interested in the future.
I would love to learn more.
Is there anything, Francis, that I didn't ask you today you'd like to share?
If you stay in one hospital or one employer for a long time, I would not recommend that. I think in Korea, Korean culture, back in the day, like my parents' generation, once you start working, you got to be loyal to that company and then you stay there until you retire. But that's not the case. I think we all know that in here in America, though. In order to market yourself, if you become a unicorn in one place, nobody will recognize you because they know you from day one. They don't know you as who you are now. I cannot say how often you should look other employment opportunities, but what I would recommend is that if you really like where you are, you can stay, but you can also stay as a per diem. That way you're not losing your seniority in case you want to come back as a full-time again. I have a lot of colleagues who jumps around, meaning every 2-3 years. If you are getting hourly pay, a couple of dollars makes a couple of thousand a year. Staying in one place for a long time, financially speaking, it's not gonna really go too high. As you mentioned in your one of your YouTubes, we get annual merit. When the hospital has the money, maybe 2, 3, 4% if you're lucky. But then with the current inflation, it's not gonna match up. In order to advance yourself to financially more secure way, the other employees, they always look for qualified nursing staff. You have to kind of market yourself, going to different seminars or conferences, learn about what other opportunities are there. For me, as a side gig, I got to learn more about pharmaceutical aspect of it. When you have a pharmaceutical company who's selling their product, hey, we know that you carry this certain product in your hospital. They need to have an educational dinner. My attending and I would go to that, and as a speaker, my attending will talk about as a physician what the challenges, if there is any. As an MP, you can talk about these are the situations that we usually order these certain medications for, and these are what we see, these are the challenges. And being involved with other than your full-time working, you can also find a side gig as a speaker for pharmaceutical educational sessions. Yeah, that's another way to branch out from what you do, and it's a good side gig. It's financially it's pretty reasonable.
Oh, that's good to know.
Also, if you like teaching, you can do part-time preceptor or instructor, but then obviously money is not there compared to how much time you actually put in.
I think educators need to be paid more.
My ultimate goal is to run a nursing school.
Yeah, that'd be amazing.
It's a business at the same time. Think about how many people actually apply for nursing, but we can only tolerate so much. There are a lot of older instructors or professors that are leaving the hospital, but we know we need to be able to digest the volume. Nurses need it. People live longer. They have more chronic diseases. They need a place to go and see by NPs or PH. They need more providers. Being a nursing background is a good thing.
I'm gonna interview you again if you ever establish a nursing school.
Oh yeah, I wish. I'm thinking about getting an MBA. Maybe that would help. I think you and I, we know a certain degree will carry.
For sure, like nursing professions, we're needed, but with the aging and retirement community and nursing population, it's increasing too.
I mean, it's a high demand. So, encourage people who want to work in healthcare. I think nursing is a fabulous profession. People can do what you're doing, inspired by you. What you're doing is great. You're opening up a lot of doors for a lot of people.
Thank you, Francis. How can the audience connect with you online if they have questions?
So LinkedIn is available. Doximity is available. Doximity is for the physicians and providers. It's kind of similar to LinkedIn.
Okay.
You don't see a lot of commercials, just strictly just for networking purpose. They have to kind of verify who you are.